Okay, goodbye everybody. I would like to make a short presentation concerning the achievements and challenges of the age-friendly municipalities in Bulgaria. This is a very short presentation concerning the overall problems that the Bulgarian municipalities have when dealing and referring to the elderly people. So you can see now the background information concerning some of the problems the Bulgarian municipalities have and some of the problems of the system overall. On the first place, we have very heavy state of the national social insurances, and if we have to say with a very simple word, the elderly people touch a lot of just very small money, and they do not have really opportunity to care about themselves. On the second place, you can see the very sharply aging population, even more sharply than in the other countries in Europe, which is very negative to the overall demographic image of the country. The third place, this is a strong internal and external migration. Internal, that means the world, the big cities, and external, of course, this is towards the developed countries in Europe and the USA. Then we have the high unemployment, which is very understandable, especially in the time of financial crisis. In Bulgaria, we put much more action on dealing with the elderly people. We put much more action on social and health, and much less on the culture and the self-protection, which is, in other words, we're dealing with primary needs that the elderly people have, instead of developing really them in culture and self-protection. We have an existing legislative infrastructure, not that, by the way, fully harmonized with European legislation, but of course, unfortunately, with a very, very bad and very poor real implementation. That's the problem of overall in Bulgaria. We have, in time of financial crisis, a very clear tendency, not only in Bulgaria, but also in other countries in Europe. This is the decrease of the municipalities' own resources. In the same time, this is an increasing centralism to the central authorities. In other words, the central authorities give more competencies to the municipalities, but with less resources, including administrative, financial, all kinds of resources. And generally speaking, all these services, the care services about the old people have a relatively low added value. That means they are not very attractive, as you can understand, from the young people, and the motivation is not very high. As an additional problems and challenges, I should enumerate, we have unfortunately large regions depopulated, and more of the population in Bulgaria is concentrated in the big cities. And we have large regions depopulated, especially in north of Bulgaria. We have elderly people living alone. A lot of people, most of them are living alone with the partner. Their partners already died, for example. They have the children living in big cities and abroad. By the way, one of the trainings we have with elderly people, this is to perfect their computing skills, so that they can communicate with children by Skype or by other computing techniques. Most of the old people have very difficult access to hospital and health services, because the settlements in non-municipalities staying away from the municipal center. Maybe should I explain that in Bulgaria, municipality is not only the center, it's not only the town, not only the municipal center. Municipality in Bulgaria comprises a lot of settlements that are located around these municipal centers. So sometimes they can be 20 or 30 or 50, and the distances can be also very big, especially in winter, and with snow, of course, it's very difficult. Low capacity in municipal services, especially in the small municipalities. Overall lack of financial resources. This is a chronic problem not only for the local authorities in Bulgaria, but also for the state. Overall, in the same time, due to the demographic crisis, we have a very increasing waiting list of elderly people. That means people that wait to receive support and informed services, personal assistance, personal social assistance, etc. This waiting list, unfortunately, will increase in the near future. Another problem, this is the low participation of the corporate sector. There are future opportunities if the corporate sector with the corporate social responsibility and also the NGO sector, of course, could be attracted in all these kinds of activities. And nevertheless, we have a lot of measures taken on the institutional level, on the level of municipalities also. We have a constantly updating database analysis and statistics. This is something which works really, and more or less we have a very clear picture, very clear image of what's happening with elderly people in Bulgaria and what the situation is. On the level of municipalities, the local level, they have very good practices, like for example, attracting elderly people on something like the target group, something like not say a consultancy, but in any case to discuss with them when developing measures on their behalf. I mean, the elderly people have to say what could be the best for them. Municipal strategies with special focus on elderly people exist in most of the Bulgarian municipalities. We have even special municipal councils, kind of consultancy that takes place every several months or quarters to discuss different measures on behalf of the elderly people. Overall, in Bulgaria, we have almost 600, 568 to be more exact, clubs for elderly people in 77 municipalities. These are not clubs for disabled people, and this is not a clubs for sick people. This is a club for where the elderly people can make social contact. They can play games, they can just talk, drinking trees, etc. All these kinds of social contacts that support them in any way. There is relatively good up-to-date with national policies, and of course, in the last years, the cooperation with the NGO sector overall in Bulgaria has been improved. Of course, a lot of other efforts have to be done in the near and middle future. We have good practices, achievements here. I show enumerate some of them. The list is far from exhaustive, of course, and a lot of other benchmarks and good practices can be added to this list. But let's begin with very often the elderly people, when they meet for the first time problems with the health problems, they don't know what to do. Therefore, in most of these centers for working with elderly people, they have lectures on health topics, lectures on health problems, what to do exactly. The most frequent services for elderly people in Bulgaria, these are the social assistance, the personal assistance, and the home assistance. There are different differences between this kind of assistance, but I cannot explain now in details exactly. We have public canteens for elderly or for very poor people, but as an interesting practice in some of the municipalities, we have canteens that are located in primary schools. And now, by that, we developed the solidarity between generations. That means that all people are going to the schools in order so that they can communicate with the schoolboys and schoolgirls, and then this can help them in feeling younger, or this is very, very positive in general, and vice versa. This is for the boys and the girls in the school to respect the old people, and so that they can communicate with them. Concerning the constant informed care services, that means the people that cannot serve themselves, we have a relatively large covering. About 85 to 90% of municipalities have this in-home care services. Only 10 to 15% do not have and do not provide this service. The municipal and the public libraries in Bulgaria serving as a cultural centers for elderly people. These libraries, there's something very old tradition. Something very, very positive, and they are not just libraries to read books. And they can be cultural centers in much larger sense of the word. I mean, they organize dancing, they organize singing, good for singing, for music, etc. Very often, the municipalities and different companies organize one-day excursions and trips with all people. That means, especially to Greece and to Serbia, and especially after Bulgaria entered the European Union, this is very close, and this is very cheap. This is very cheap. Just for one day, they can go somewhere, and so distract themselves. Music and sport teams for elderly people. We have a lot of music and sport teams. Holidays in the seaside and in the mountains. This is also a practice that was developed in the last years. As far as I know, on a random basis, they select all people to visit the holidays in the seaside and the mountains in a very good condition. The municipalities organize daily centers for elderly people, centers for social care, and also daily centers for people with disabilities. Something very interesting also, we need to be like each other. As you know, there is no limit for love. They can organize wedding parties in institutions for elderly people, especially if these people can and want to live together in the rest of their lives. As the conclusions and recommendations, I should enumerate an increasing need to cover the elderly people by different services, both in scope and freedom. This is kind of challenge, let's say, due to the demographic crisis and the sharply declining the negative trends in the society. Upgrading the existing services, that means these services have to be upgraded in the future with by quality, and for that administrative capacity of the municipalities has to be strengthened. The development and cooperation with the NGO sector has to be enlarged. Of course, this is developing the last year, but nevertheless, still more has to be done. A better implementation of the EU funded projects. This was the first programming period for Bulgaria. A lot of shortcomings have arise during the last years, and of course this has to be, and it's a challenge for protection. Additional pillars in the social insurance system and additional funds. This is an idea that I don't know, and we don't know exactly how it will be still developed, but there is a lot of effort in this direction. This is also a kind of challenge for the future. Some development of principles of the community-led local development and the integrated urban plans. You know, these are the new tools of the European Commission concerning the integrated urban plans and the new development of the urban infrastructure for the next years. And my idea is that this class, of course, a special accent for elderly people has to be put on and has to be encouraged. Encouraging the sport activities, not as good as the sport, of course, in everyone age. And we have good traditions in this as I have mentioned several times. We are planning also with, municipalities together with the agencies responsible, etc., awards for age-friendly municipalities, kind of stimulus and encouraging municipalities to deal with all these problems. The cooperation with the corporate sector for sure has to be increased. Has to be increased, has to be improved for the future, especially the corporate social responsibility, and somehow finding the funds for attracting more and more the corporate sector to these activities. Improvement of overall architecture and urban infrastructure. This is let's say, overall problem, not only concerning the elderly people, but indirectly, of course, related to all these problems. Better access to banking services, especially the credit. In Bulgaria, the elderly people have a very difficult access to the banking services, especially the credit. Usually, they receive their money by banking way, and they use the card. But the credit, especially, is something that they don't have so much access to, and also an idea, let's say, very innovative idea here. So I put something in brackets, namely the problem that we have lack of financial resources and very heavy problems with that. So our municipalities try to compensate by being very innovative, by putting very new incentives, new innovations, etc. So closing the brackets, and here the elderly entrepreneurship has to be used, a new forms about how to use the experience and the brain of the old people and their wish to work, especially in different forms of entrepreneurship for elderly people. So this is more or less what I wanted to present to you. I thank you for your attention. I should be ready to reply your questions by written way. Thank you very much.
Thank you very much, Dimitar. I will send you an email to the participants, and if they have questions after viewing your presentation, I think they can send you an email and see if you can reply to them. Thank you very much.
Thank you very much for finding a way to improve the relation.